Welcome to this channel made for me. In this video, we will start discussion about how to take history. So in medicine and in surgery and in pediatrics, the history of pattern is different, but around 80% the pattern is same. So let's start with the particulars of the patient. So at first, when we start taking the history, then at first we take the patient particulars. In patient particulars, what are the important points that we should never miss? We remember as a mnemonic, that is NASA ROM. NASA NASA and ROME ROM, NASA ROM, which means that N is for name. So why we do mention name in history? It is because one is for identification. One is for identification. The second one is that when we uh, introduce ourselves with the patient, and when we ask the patient, then there is the rapport building, and there is rapport building. So for rapport building, we ask the name. And the third one point is the medical legal purpose. So these are the 3 points due to which we mention name in the patient particulars. Now A means age. So the disease pattern is different among different individuals. In childhood, most commonly, congenital diseases are more frequently seen. Congenital diseases are more frequently seen. Like if patient is presenting with hernia in 1 year or 2 year, then it is due to congenital hernia. Okay. Similarly, in old days, the diseases are usually degenerative disease, like Alzheimer's disease, multiple sclerosis. Okay, degenerative disease. Now we talk about sex. As for sex, so in male, some diseases are only found in male, like X-linked recessive disorders, X-linked recessive disorders. So what are those? There's like hemophilia, and color blindness. Okay, and in female, some diseases are more common, like SLE. SLE are most frequently found in female, and thyroid disorders. These thyroid disorders are usually found in females. SLE and thyroid disorders. Okay, so due to this reason, uh, we take history of sex. Now, fourth point is A. So A means address. So during address, we took two address. One is temporary address, and another is permanent address. So why we took these two different address? It is because if the patient is living near to the hospital, then she can come easily for the follow-up. But if the patient is far away from the hospital, like she has to travel, or he has to travel around 4 to 5 hours, or long distance night travel, so for that patient, the follow-up is very difficult. So in that case, the doctor considered that if the patient can follow up easily, then uh, the medication and investigation which can be done very easily. But if the patient cannot follow up very easily, like in the far remote areas, then the doctor give medication, and for more duration, and the doctor suggests the patient to take local advices from the nearby hospitals uh, by seeing the prescriptions. Okay, so for this purpose, this temporary and permanent address is important. Now, the fifth one is R. So R means religion. So R means religion. Why we take religion? It is because, like in Islam, like Islam, in Islam, there is a culture of doing circumcision. Okay, so there is culture of doing circumcision. So by doing circumcision, lots of uh, penile diseases can be prevented. Like during circumcision, what happens? There is the removal of the foreskin, due to which the smegma formation or the urine after urination, they are not collected in the foreskin, okay, because it has already been removed. So the chance of the penile diseases and penile cancers, they are less common in Muslims. So in Islam, due to circumcision, there is less chance of carcinoma penis. Okay, and this culture is also following Jews. Okay, so in Islam and Jewish community, circumcision, due to circumcision, there is less chance of carcinoma penis. And in Islam, there is also habit of uh, there is also following where the pig is not used as a meat. Okay, so in Islam, pigs are not allowed. Okay, due to which they are less prone to they are less prone to guess what? They are less prone to tinea solium. They are less prone to tinea solium. That is tapeworm. And in Islam, there is more practice of taking these cows, buffaloes, okay. So there is more, there is more chance of tinea seginata. Tinea seginata. So one is the pork tapeworm and another is the beef tapeworm. And talking about the Hindu community, Hindu religion, they usually take the veg food on the priority. Okay, so chance of this bowel related problem and bowel related carcinoma are very less common. So due to veg eating practice, they are less prone to carcinoma. Okay. Now let's talk about this occupation. So occupation. So in occupation, like patient who are more exposed to the mine, like mine workers, they are more chance to silicosis. Okay, so the mine worker patients are the mine workers patients are more prone to silicosis. And the patient who work in paint industries, like paint industries and dye industries, they are more prone to carcinoma urinary bladder. Okay, and talking about the surgery, the patient who stands for a prolonged duration, like um, bus conductors, teachers, and surgeons, they usually prolong for a long duration, so they are more prone to this chance of varicose vein. Okay, now the second last one is M. So M is for marital status. So M is for marital status. that is either the patient is married or unmarried. Why this is important? Because if the patient is married, then she has one partner, due to which there can be more chance of the regular medication, more care, and there is less stress of work. Okay, but in case of unmarried, yes, there may be mother, father, and other family members, but there is no spouse, so uh, there is a little problem in comparison to married. Okay, in case of adult, but in case of children, there is no such problems. And the second reason is that this unmarried person, they usually, they not usually, they may go to involved in sexual practices. Okay, uh, so there can be chance of transmission of sexual transmitted disease if the patient is having multiple partners. So for this, marital status is also important. Now the last one is education. So why education is important? It is because the education level tells the patient that uh, how much he or she is educated, and due to which it helps in the doctor uh, to counsel the patient in their understanding level. Okay, so by this, our this patient particular will be complete. And in some hospital, there is also practice of mentioning the date of admission, and the second one is the date of examination. And second one is date of examination. So while writing the history, how we write in the present particulars, it is like, for example, for example, for example, if the patient is 40 years, so 40 years female, 40 years female, her name is Sita Kumari, 40 years female, Sita Kumari. So name, age, sex. Now, 40 years female, Sita Kumari, following Hindu religion, following Hindu religion from following Hindu religion from Uttar Pradesh, currently living in Delhi, educated up to class 12, working in work, working in delivery service, working in delivery, married for 15 years, date of admission and date of examination, date of admission and date of examination, presented with the chief complaints of presented with the chief complaints of. So in this way, we write the patient particulars. So here we have mentioned the name, the age, sex, NAS, and address. One is the temporary address and another is permanent address, NASA. Then R means religion also mentioned. Then O, O means occupation. Occupation is also mentioned. M for merit, it is also mentioned. And the last one is E, education is also mentioned. So every points of the patient particular has been covered here. And if the patient is asked to take a history in the OPD, then we do not mention this date of admission. But if the patient is in ward, then we also write the date of admission and date of examination. Otherwise, only date of examination is important. And after this, we write the chief complaints. So now the second point is the chief complaints. In this way, our patient particular is completed. Okay. Now the second one is chief complaints. We write chief complaints in a chronological order. Like if the patient is presenting to the OPD, okay, if the patient is presenting to the OPD with abdominal pain, with abdominal pain, okay, abdominal pain for 2 days and fever for 3 days. Is this pattern correct in the chronological form? No, this pattern is not correct. Why? Because fever presented early, that is fever is lasting from 3 days and abdominal pain is just uh, 2 days back. So 3 days, the fever which has been 3 days earlier, we have to write that fever 3 days in the first point. Fever 3 days in the first point. Fever for 3 days. The second one is abdominal pain for 2 days. So this is in the chronological form. Now during during chief complaint, what we have to look very cautiously is that we have to mention chief complaints in the 3, 2 or 3 or 4, but not more than 4, because the chief complaint which we present here, it should be elaborated in the history of present illness. So if we will make 4 chief complaints, then each chief complaint, when it will be described, it will be very long history, so we will be lost in the sea. So do not make those type of mistakes. So just make a chief complaint of only 2 or 3. Okay, just 2 or 3, like fever for 3 days and abdominal pain for 2 days. Now after these chief complaints, uh, we will start doing history of present illness. History of present illness. In exam, what we have a habit is that we say usually HOPI, but this type of practice we should avoid, because in exam suddenly this history HOPI speaks out from our mouth. So please do not make mistake and practice in the pattern of history of present illness, HOPI. And in HOPI, we have to explain the chief complaints. Okay, and this chief complaints, how it should be made, that the patient present with lots of problem. She will say, oh, this has also been there is a pain in head, there is pain in head, there is pain in eye, there is pain in abdominal pain. Okay, lots of complaint will be presented by the patient to the doctor. So we have to analyze what is the main complaint. So what we have to ask is that, what made you brought to this hospital? What are the symptoms that made you brought to this hospital? So these are only the chief complaints. Okay, and these chief complaints will be explained in history of present illness. Now let's talk the history of present illness. So while explaining the history of present illness, it should be in patient's own word, in patient own words. No medical terms should be used. No medical terms should be used. And also, do not ask any leading question. Do not ask any leading question. Leading question. I will give example of these two. One is the abdominal pain and the fever. Okay, so the first, let's talk about the abdominal pain. Abdominal pain. So while asking about the abdominal pain, any pain, any pain, we ask in the format of Socrates. 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 So in Socrates, what does S means? So S means site. S means site. Like if this is the abdomen, this is the abdomen. We divide the abdomen in four quadrant. We divide abdomen in four quadrant. Okay. This is there are four quadrants, not nine quadrants. There are four quadrants and nine regions. Nine regions. I will explain about this quadrant and region in the next video. Here, just imagine that the abdomen is divided into four quadrants. So this is upper right, upper left, lower right, and lower left. So while also mentioning the chief complaint, do not write just on the abdominal pain. What we have to say that upper right abdominal pain, lower left abdominal pain, which side, this should also be mentioned. So here we have to write like lower right abdominal pain for 2 days. Okay, lower right abdominal pain for 2 days, or upper right abdominal pain for 2 days. Okay, so in this way we have to write in the chief complaint also. So in HOPI, we have to mention about first in pain site. So site is upper right, low, upper left, lower right, or lower right. Why we are not mentioning about these reasons? Because the reason which we divide, it is in the medical term. Like it is there is a, if we divide in nine reasons, then what happens is that one is the epigastric area, right hypochondriac, left hypochondriac, umbilical. So these are all the medical terms which we should not use in this history of present illness, because it should be in the format of patient own notes. Okay, so just mention the site. Now onset. Onset. How did it start? Like the onset is like acute onset, okay, or gradual onset, okay. What type of onset is that? Okay. So SO. Now C. C means character. What type of pain is present in the patient? Like if the pain is like shooting pain, then it is most probably due to any nerve, any neural cause, okay. Shooting pain is due to neural cause. Other character are like it can be sharp pain, okay, sharp cutting like pain, okay. It can be dull aching pain, it can be burning pain. The burning pain, it can be present like in peptic ulcer. Okay, now after talking about the character, we ask the radiation. We ask the radiation. So for asking radiation, how we ask that? We ask patient, is the pain which is present, it is also present from the beginning, or it has been transferred from one place to another. Okay, so if pain is usually in the upper right quadrant, okay, if the pain is usually present in the upper right quadrant, in the first and after 2 hours, this pain has been transferred to this lower right quadrant, or this pain has been transferred to any other body part, like it has been transferred to neck, okay, either neck or in shoulder, anything can happen. So during radiation, we ask patient, the pain is usually the first pain, is usually where. So if like first pain the patient feels around the umbilical region. The patient feels first pain around the umbilical region, and after about 3-4 hours, the pain migrated, the pain migrated to the where? The right lower region. Okay, the right lower region. So this gives the clue of thinking of acute appendicitis, acute appendicitis, appendicitis. Okay, so similarly, we have also we should also ask that the pain which is present, either it is shifting from one side to another side in this way, and another, if like pain is in the right upper quadrant region, then this pain has been transferred to shoulder. This pain has been transferred to either shoulder. So there can be chance of any pathology in the right upper quadrant region. Okay, and if the pain is like in the left, like in the not left, if the pain is like present in the chest, with which chest, we have also to mention either right or left. So like if patient is presenting with pain in the left chest, and this pain has also been radiating, this pain has also been radiating to arm. Which arm? Left arm or neck or jaw. Then there can be chance of to suspect like myocardial infarction or any angina or any cardiac pathology. Okay, so in this way we suspect pain. Again, let me clear that if the patient present with the pain first in the umbilical region, okay, then this pain has been transferred to this um, left lower right region, then there can be chance of acute appendicitis. Similarly, if the patient is first presenting in the pain in the left chest and it is also radiating to the left arm or neck or jaw, then there can be chance of any cardiac cause. Now we have to also know the difference between the migration of pain, the shifting of pain. Sorry, this migration and shifting is the same thing. The second one is referred pain, and the third one is radiation of pain. These are the three terms which we have to know. So in migration or shifting of pain, the I will mention like A and B. Okay, these two sides. So if the patient is feeling pain at A side, okay, and this pain after 2 hours or after 3 hours or after any time, this pain gets shifted to site B, and the pain which is present in the site A, it absent. Okay, so initially pain was present as A, now this pain has been shifted to B, now there is no pain in the A. So this type of pain is the migration or shifting of pain. Where it happens in acute appendicitis. I have already given the example here, acute appendicitis. In case of this referred pain, what happens is that there is pain which is felt. There is pain which is felt at a distant site. Suppose if you consider this as the abdomen, then the pain is felt at a distant source and there is no pain at the site of disease. Like if there is suppose this is diaphragm, and if there is any irritation of diaphragm, if there is any irritation of diaphragm, then the pain is not felt at the diaphragm, but this pain is felt at a distant site where there is no pain at the site of disease. Okay, pain is felt at a distant site from the source and there is no pain at the site of disease. So where does this pain feel? This pain is felt at the tip of shoulder, where it feels like it feels at tip of shoulder. So irritation of diaphragm, actually there is irritation of diaphragm. The site of disease is this. The site of disease is this irritation of diaphragm. This is the site of disease, but there is no any pain in the abdomen region. Where the pain is occurring? The pain is occurring at the tip of the shoulder. So this type of pain is known as referred pain. And why does this happen? It is because the tip of shoulder is supplied by cranial nerve C4 and C5, and this diaphragm is supplied by C3, C4 and C5. So the dermatome is same like C4 and C5. So if the pain is occurring at the C4 and C5, this that diaphragm C3, C4, C5, then the brain forget to differentiate either this pain is coming from this side, from the tip of shoulder. So the pain start to happen at the tip of shoulder, which is because due to the C4 and C5. Now third one is the radiation of pain. So radiation of pain means that the pain is present at the original site also, and it is also extending to the other side. The pain is present at original site also and at another site also, like in case of peptic ulcer. So what happens in peptic ulcer? The pain is present in the epigastrium, and this pain also present in like it radiate to where does this radiate? It radiate to back. So if the pain is present in both the original site and the radiating site, okay, at both sides, then it is radiation of pain. But in case of recurrent pain, the pain is not felt at the site of disease, but it is present on the another side. So this is referred. And migration means the pain is usually present in the one side and later pain disappears there and the pain start occurring in the next side. So this is migration or shifting of pain. Hope you understand. Now talking about A, SOC radiation is also completed. Now A. So A means associated symptoms. A means associated symptoms. Like the patient is feeling, we are talking about examples of abdominal pain. So let's talk about the abdominal. So what are the associated symptoms of abdominal pain? Like the pain can be associated with nausea, vomiting. Okay. So if the pain and it is associated with nausea and vomiting, there can be it is a type of like colicky pain. And it is due to the peristaltic movement. Okay. So also in the acute appendicitis, what happens? There is a obstruction in the appendix lumen. So appendix tries to contract the lumen, due to which the obstruction, like ficcolith, which is causing the obstruction, it gets removed from the appendix, but it fails. So during when the appendix is contracting, this causes the colicky pain, and this result to the nausea and vomiting. Okay, so one can be nausea and vomiting associated symptoms. Another can be like fever. So fever, why it is occurring? It can be due to infection. So if there is fever, you have to suspect about infection. And if abdominal pain is associated with jaundice, like yellowish discoloration, then we have to think about the yellowish discoloration of what? Of eye. Okay, of eye or skin. Then we have to think about this jaundice. So this can be associated symptoms. Now talking about T. So T means timing. Either the pain which is occurring, it is at any special time. Or not. Like the acute appendicitis pain, it is usually on waking up in the morning. Okay, and like duodenal ulcer. If the patient is having the duodenal ulcer, then this pain starts in the afternoon, in the afternoon, or when the patient is, or when patient is hungry. During this, the pain is present in duodenal ulcer. And when the patient take food, when the patient take food, this pain disappear. Pain disappear. But in case of gastric ulcer, the pain starts occurring after food. After food, pain starts. So it is not during the hungry phase, but it is during the after taking food. So during time T, we mention about is there any special time, okay, and how much duration this pain is lasting, how much duration this pain is lasting, like it can be 10 minutes or 1 hour, 1 day, for how much duration this pain is lasting. Then we have also to ask, like, it the pain is either episodic or continuous. So these are the 3 points which we have to ask during T. Now E means is there any exacerbating factors for pain? Exacerbating factors, or is there any relieving factors? Relieving factors. For example, like in case of appendicitis, when the patient runs, or when the patient moves, or when patient do jolting, then this the pain which is present, it aggravates, okay. And if there is a peptic ulcer, if there is peptic ulcer, then ingestion of spicy food, then ingestion of spicy food aggravates, okay. Ingestion of spicy food aggravates. So these are the exacerbating factors. Now relieving factors for acute appendicitis, like if the patient remains stills, if the patient remains stills, and if patient recess, and if the patient recesses the iliac fossa, pain relieves. But as soon as the patient removes his hand from the iliac fossa, again there is the sharp pain. So we have to also remember that point. And in case of relieving factors in peptic ulcer, if the patient is having any alkali or antacids, then this pain get removed, okay. This pain gets removed. Now the last point is S. So S means severity. So how we assess severity? We ask the patient, like, choose a number between 1 and 10. 1 and 10. Where 1 is there is no pain, and 10 is there is severe pain. When 10 is there is severe pain, okay, and 5 is mild. We counsel the patient about 1 to 10. Now we ask patient how much number will you give to this pain when there is the either acute attack, or if the patient is having pain continuously, then during that time what number will you give? Like if the patient gives like 7, more than 7, okay, then this is severe pain, okay, hence this is severe pain. But if the patient says like 1, 2, 3, then we can consider there is only mild pain, okay. And the patient talks about like 4, 5, 6, then we assume that it is a moderate type of pain. So if we do not mention this severe, mild, and moderate in our history of present illness, we just say that the patient gives a score of like 7 by 10 on 1 to 10 scale rating. Just we mention this point during presentation. Now I have completed this associated symptoms about sorry this about pain, this pain history of present illness. Now I will also mention some few points of fever. So what we have to ask during fever? So during fever, first we have to ask that there is a mnemonic which I have made, which I use in every history of present illness, that is OPD Socrates. OPD Socrates. In every chief complaints while presenting in history of present illness, I remember this point in my mind and I ask patient in the same way. So it makes me very easy. So in fever, first one is the onset. The patient is presenting either acute or gradual. We have to ask this. Okay. Then P means progression. P means progression. Either it is progressing or not. Progression. Then D means duration. Almost it is last. Now S means during fever there is no use of this S site, so we do not consider S. And O already mentioned OPD. C means character. So for fever character there is no any character, but we divide the fever in 3 points, and these 3 points are the what are the different types of fever. So it is can be remittent fever, it can be remittent fever, it can be continuous fever, or it can be intermittent fever. So these are the fever which we mentioned. We will explain now later on. Now R means radiation. There is no use of any radiation in fever. A means associated factors. So associated symptoms. What can be associated with fever? It can be associated with nausea, vomiting, okay, abdominal pain, chills, rigors. Like if in the abdominal pain, nausea, vomiting, it is not mentioned earlier, then we can, and if it is associated with the complaint, then we can write here. And we always mention these chills and rigors. But in case of children, like they cannot feel, we cannot ask the patient about either the patient is having cold, like in case of pediatric group, neonates, infants, we cannot ask, we cannot assume the patient is having cold, so we do not mention these chills and rigors. But in case of adults, we have to mention this chills and rigor, either it is associated or not. And it is usually present in like severe malaria. Okay, chills and rigors are severe malaria, in Kala-Azar. Okay, so during this, there can be associated with chills and rigor. And the T, the fever T is also not important. And E, exacerbating factors. So exacerbating factors, we do not write exacerbating factors, but we write relieving factors. We write relieving factors. So how does we ask the patient how does this fever decrease? What are the factors that are increasing and decreasing the fever? Okay, so the patient mentioned that while taking paracetamol, the fever decreases. Fever decreases. So we have to mention this. And the next one is severity. So how we ask? So the maximum recorded temperature is how much? So the patient says that 104 degree Fahrenheit. So we mention that the patient is having maximum recorded temperature is 104 degree Fahrenheit. But if the patient says we did not record the temperature, then just we have to mention that the temperature is not recorded. Temperature is not recorded. So in this way, we write about the fever. Now let's learn how to present the present illness. So the HOPI, while we present the HOPI, we write like the patient the was apparently patient was apparently well 3 days back. We write this point in every history of present tense. Patient was apparently well 3 days back when she developed pain in right upper abdomen. We are talking in the similar manner of these chief complaints. So abdominal pain for 2 days and fever for 3 days. So if there is the chief complaint in the first fever, then we write the complaint of fever first. Okay, this should never be made mistake. The first complaint which is presented early, it should be written at first in the chief complaint also, and during explanation in the history presentedness, it should be explained in the first. So um, here we have to write the fever. We have to write fever. So patient was apparently well 3 days back when she developed fever fever which is, now we have to think about OPD secrets, which is gradual in onset, progressive. Like initially, the recorded temperature was around 99, then it became 100. The patient says that. Then 101, then it is the progressive onset, progression, and D means duration. So C develop fever, which is gradual in onset, progressive, and what type of character it is? Like it is intermittent type. Intermittent type, and there are some special character of fever also, like it can be step ladder pattern type of fever, which is present in typhoid. Okay, there is a pale abstain fever, there is saddleback fever, which is present saddleback fever, which is present in dengue, and maximum recorded temperature maximum recorded temperature is 103.6 degree Fahrenheit, not on Celsius, on Fahrenheit, and no aggravating factors. No aggravating factors. But fever decreased on taking paracetamol for 5 hours. Okay, so in this way we have to write the chief complaint about fever, and also means we have to mention that it is not associated with chills and rigors, and it is no any diurnal no any diurnal variation. Why we have to mention this diurnal variation? It is because, like in tuberculosis, the fever usually happens in the evening rise. So we write that evening rise of temperature in case of tuberculosis. So we have to also ask the patient that the fever is either present in either in the morning or in the daytime or in the afternoon, or it is present at any time. Um, we have to also ask such points. So in this way, the patient first chief complaint is explained. Now, in the same way, we have to explain about the abdominal pain also.